NCLEX PN Effective Resource Management in Healthcare Settings. Understanding resource management. Resource management involves the efficient and effective use of staff, supplies, equipment, and time to ensure quality patient care while balancing patient needs with available resources and minimizing waste. Definition: the efficient and effective use of staff, supplies, equipment, and time to ensure quality patient care. Purpose: balances patient needs with available resources while minimizing waste and unnecessary expenses. Benefits: enhances patient care quality, reduces costs, and improves staff efficiency. Foundation: based on evidence-based practice and continuous quality improvement principles. Importance of resource management. Effective resource management plays crucial roles in healthcare delivery and organizational sustainability. Patient care enhancement. Ensures essential resources are available when patients need them. Prevents delays in treatment due to supply shortages or equipment failures. Optimizes staffing to provide appropriate nurse-patient ratios. Supports quality care delivery through efficient resource allocation. Cost control and efficiency. Prevents unnecessary waste of supplies and equipment. Reduces healthcare costs through efficient resource utilization. Helps healthcare facilities stay within budget constraints. Improves overall organizational financial sustainability. Staff efficiency and satisfaction. Allocates workload fairly among healthcare team members. Prevents burnout through appropriate staffing and resource availability. Improves job satisfaction through efficient work processes. Reduces stress caused by resource shortages or inefficient systems. Regulatory compliance. Meets regulatory requirements and accreditation standards. Ensures ethical resource allocation and patient safety standards. Supports quality improvement initiatives and patient outcomes. Demonstrates commitment to responsible healthcare delivery. Types of healthcare resources. Healthcare resources encompass various categories that must be managed effectively for optimal patient care delivery. Human resources, staffing and workload. Nurses, physicians, certified nursing assistants, and therapists. Appropriate staffing ratios based on patient acuity and care needs. Skill mix considerations for different types of patient care. Staff scheduling and workload distribution. Material resources, supplies and equipment. Medications, personal protective equipment, and fluids. Medical devices, linens, and disposable supplies. Proper inventory management to prevent shortages. Equipment maintenance and replacement planning. Financial resources, budget and cost management. Cost-effective treatment planning and resource allocation. Prevention of unnecessary hospital admissions and procedures. Insurance and payment management for services provided. Budget monitoring and expense control measures. Technological resources, information and medical technology. Electronic health records and information management systems. Medical equipment including monitors, pumps, and diagnostic devices. Telemedicine capabilities and communication technology. Data management and decision support systems. The nurse's role in resource management. Licensed practical nurses have important responsibilities in managing resources effectively and efficiently. Patient care assessment. Assess patient needs to prioritize resource allocation based on acuity and urgency. Monitor resource utilization and identify areas for improvement. Evaluate effectiveness of resource allocation on patient outcomes. Advocate for necessary resources to ensure safe patient care. Supply and equipment management. Prevent waste by using supplies efficiently and appropriately. Monitor inventory levels and report shortages promptly. Ensure proper storage and handling of medications and supplies. Follow established procedures for equipment use and maintenance. Documentation and communication. Track resource usage and document accurately for quality improvement. Communicate resource needs and concerns to supervisors and managers. Participate in cost reduction initiatives and efficiency improvement projects. Report equipment malfunctions and safety concerns immediately. Patient education. Educate patients about resource-conscious healthcare practices. Reduce unnecessary emergency department visits through patient education. Promote preventive care to reduce long-term healthcare costs. Support discharge planning to prevent readmissions. Effective staff resource management. Managing human resources effectively ensures appropriate staffing levels and optimal patient care delivery. Staffing prioritization strategies. Prioritize patient care assignments based on acuity levels and complexity. Assign tasks to team members based on skill levels and scope of practice. Adjust staffing schedules based on patient census and care requirements. Ensure fair distribution of workload to prevent staff burnout. Delegation and team coordination. Delegate appropriate tasks to certified nursing assistants and unlicensed personnel. Coordinate with other departments for efficient patient care delivery. Support new staff members through mentoring and orientation programs. Foster teamwork and communication among healthcare team members. Professional development. Encourage continuing education to maintain and improve staff competencies. Support career development opportunities for team advancement. Cross-train staff members to increase flexibility and efficiency. Recognize and reward efficient resource management practices. Supply and equipment resource management. Effective management of materials and equipment ensures availability while minimizing waste and costs. Supply management best practices. Use only necessary amounts of supplies to avoid waste and overstocking. Monitor inventory levels regularly to prevent shortages or excessive stock. Coordinate with supply chain teams for efficient ordering and delivery. Implement cost-saving strategies when safe and appropriate. Equipment management strategies. Maintain equipment properly to extend useful life and prevent breakdowns. Schedule regular maintenance and calibration for medical devices. Report equipment problems immediately to prevent patient safety issues. Use equipment efficiently and share resources among departments when possible. Inventory control systems. Label and rotate medications and supplies to prevent expiration waste. Use first in, first out principles for perishable items. Maintain accurate inventory records for budgeting and planning. Implement automated systems for inventory tracking when available. Time management as resource optimization. Time represents a valuable resource that must be managed effectively to provide quality patient care efficiently. Priority setting for time management. Focus on critical patient needs first before addressing routine tasks. Use established frameworks for prioritizing patient care activities. Minimize time spent on non-essential activities and documentation. Coordinate care to reduce duplication and unnecessary steps. Delegation and workflow efficiency. Delegate appropriate tasks to unlicensed personnel to maximize efficiency. Cluster care activities to reduce unnecessary patient room visits. Use technology effectively to streamline documentation and communication. Eliminate workflow barriers and inefficient processes when possible. Professional time management. Develop personal organization systems for managing multiple responsibilities. Use checklists and reminders to ensure task completion. Plan ahead for complex patient care activities and procedures. Communicate effectively to prevent delays and misunderstandings. Challenges in resource management. Healthcare organizations face various challenges that can complicate effective resource management. Common resource management issues. Understaffing leads to nurse burnout and compromised patient care quality. Supply shortages, delays in treatment, and increased patient safety risks. Budget constraints, limited resources for new equipment and quality improvements. Poor communication, misuse or duplication of resources due to information gaps. Impact on patient care. Delayed treatments and procedures due to resource unavailability. Increased risk of medical errors during resource shortages. Reduced patient satisfaction with care quality and outcomes. Potential safety issues when resources are inadequate or inappropriate. Strategies for managing challenges. Develop contingency plans for common resource shortages. Implement efficient communication systems for resource coordination. Advocate for adequate resources through proper channels. Focus on high-impact improvements with available resources. Technology and resource optimization. Technology plays increasingly important roles in healthcare resource management and optimization. Electronic health records and resource management. Reduce paper waste through electronic documentation systems. Improve efficiency through automated workflows and decision support. Enhance communication and coordination among healthcare team members. Provide data for resource utilization analysis and improvement. Automated inventory systems. Prevent supply shortages through automated reordering systems. Reduce waste by tracking expiration dates and usage patterns. Optimize storage space and reduce inventory carrying costs. Provide real-time visibility into supply levels and needs. Telemedicine and remote care. Reduce hospital visits for minor conditions and routine follow-ups. Optimize specialist resources through virtual consultations. Improve access to care while reducing transportation and facility costs. Enable remote monitoring to prevent hospitalizations. Scheduling and staffing technology. Optimize staff schedules based on patient census and acuity. Reduce overtime costs through better scheduling practices. Improve staff satisfaction through flexible scheduling options. Match staff skills with patient needs more effectively. Leadership role in resource management. Nurse leaders and managers play essential roles in resource management and optimization initiatives. Leadership responsibilities. Ensure appropriate staffing levels based on patient needs and safety requirements. Advocate for necessary resources including supplies, equipment, and personnel. Develop policies and procedures for efficient resource utilization. Train and educate staff on resource management best practices. Budget and financial management. Monitor departmental budgets and expenses regularly. Identify cost-saving opportunities without compromising patient care. Justify resource requests with data and evidence. Implement cost control measures while maintaining quality standards. Quality improvement integration. Connect resource management with patient safety and quality outcomes. Use data to drive resource allocation decisions. Implement evidence-based practices that optimize resource use. Evaluate resource management effectiveness through quality metrics. Case study example. Real-world examples demonstrate successful resource management strategies and positive outcomes. Resource challenge scenario. Hospital experiences shortage of 4 infusion pumps during peak census periods. Nursing units compete for limited equipment resources. Patient care delays occur due to equipment unavailability. Staff frustration increases due to workflow disruptions. Management solution implementation. Nurses prioritize 4 pump usage for critical and high acuity patients. Alternative delivery methods such as gravity infusions used when appropriate. Supply chain team notified for urgent equipment procurement. Staff educated on proper equipment care to reduce breakdown rates. Positive outcomes achieved. Improved patient safety through prioritized equipment allocation. Reduced equipment-related care delays through alternative methods. Enhanced staff satisfaction through proactive problem solving. Long-term improvement in equipment management and availability. Lessons learned. Proactive planning prevents resource crises. Staff education improves resource utilization efficiency. Communication and coordination enhance problem-solving effectiveness. Quality outcomes improve when resources are managed strategically. Summary and professional development. Resource management ensures optimal patient care through efficient use of staff, supplies, equipment, and time. Licensed practical nurses play vital roles in staff management, supply utilization, and time optimization while technology streamlines resource tracking and usage. Effective delegation and prioritization improve efficiency, and addressing challenges like understaffing and supply shortages requires proactive solutions and professional collaboration. Key takeaways for practice. Resource management directly impacts patient safety and care quality. Efficient resource use benefits both patients and healthcare organizations. Professional collaboration optimizes resource allocation and utilization. Continuous improvement approaches enhance resource management effectiveness. Thank you for learning about resource management in healthcare. Your commitment to efficient resource utilization contributes to better patient outcomes while supporting sustainable healthcare delivery for your organization and community.